So, good morning, afternoon, or evening, depending where you are in the world, to you all. My name is Professor Dr. Laure Jacquemin. I'm a postdoc researcher and tinnitus expert at the Antwerp University Hospital in Belgium. So English is not my native language, so apologies for any accents you might hear in my English. I'm also head of tinnitus and hyperacusis therapy and science communication here at Tinnibot. And the goal of today is that I will tell you more about how we can personalize tinnitus management to you as a patient. In the past years, decades ago, it used to be the case that we thought that we would have a therapy that fits everyone and that everybody goes through the same journey. But that's not the case, we know by now. And we have to find out what works for who and what might work for you. That is, of course, the question of today. So today I will go more into the tinnitus profile, like I like to call it. The tinnitus profile is for me your puzzle, the puzzle pieces, the elements that makes your tinnitus being present and sometimes being very intrusive. What are the contributing puzzle elements there? So to find out that those puzzle pieces, I will explain to you how those puzzle pieces lead to tinnitus, so the working mechanism behind all these puzzle pieces. And lastly, how that can influence your tinnitus journey, how it's important to know these puzzle pieces to actually start determining the path that you will go for in your tinnitus journey and for tinnitus management. So first, I would like to start about explaining a bit more about that tinnitus profile. What is it? Well, it's something that's very unique to each person. The goal is to identify triggers or causes of your tinnitus. And I say both because causes is not always possible. Some people really know what the causes of their tinnitus, and that's very clear. But that's not always the case. And it might be more that there are triggers instead of causes that you can identify. So things that increase or decrease your tinnitus, we call triggers. So that I will go into in more detail later is what can these triggers and these causes be? What is important to identify? And with the help of those triggers and causes, we can determine the most suitable path for your tinnitus management. So let's dig into that tinnitus profile. First of all, you might know that hearing loss is a big contributing factor in the tinnitus story. For a lot of people, there is some hearing loss involved. And I will explain in a bit how that hearing loss can lead to tinnitus and how that might be also important to then start managing your tinnitus. So hearing loss is the most logic one, but it's also often because if people then don't identify hearing loss as a cause or trigger of their tinnitus, they feel left out because it looks like this is the only puzzle piece that matters, which is not the case. There are other puzzle pieces or other triggers and causes, like, for example, our body, our somatic system, and more specifically, our neck and our jaw. Definitely high in the neck and the jaw. If there is tension there, if there is discomfort there, that can influence and even cause tinnitus. Also, anxiety and depression. It can be that there was already, before you got tinnitus, that there were already some feelings of anxiety, some feelings of depression. Also, that makes it more likely to have tinnitus or to get a quite intense, distressing tinnitus. And it's, of course, also a vicious cycle that you will create there. The tinnitus is not going to make you feel better and probably even trigger more these feelings of anxiety and depression that you might already had. So it's definitely an interaction that is happening there. But important to acknowledge, we often see tinnitus starting in a period of a depression. And then the hearing loss, for example, might not be such a big factor. But it's also important to identify what are the problems you experience. Problems with concentrating, for example, problems with sleeping, falling asleep, or staying asleep. It's also important to choose your tinnitus management options afterwards. And also the role of stress. I know it's not always the nicest thing when a doctor asks you about your stress. It seems like stress is nowadays the cause of everything. But sadly, it's a very big contributing factor also in the tinnitus story. So we see there high correlations, high influence. If people experience a lot of stress, there is more likely to get tinnitus or to be distressed from the tinnitus and so on. But also that I will explain a bit later how that works. So I would like to get to know the people in the audience a little bit before I go further. So if you now know all these puzzle pieces, which I will explain later, but you have already kind of overview, what do you think at this moment is important to your tinnitus profile? So normally you see now a poll popping up if everything works well. And the question is, which elements are part of your tinnitus profile? Multiple options are possible normally because that's also the case. There's not only one factor that influences everybody's tinnitus. It can be a combination of factors. You might know you have some hearing loss, but actually the increased stress was clearly the trigger of your tinnitus getting started or so on. So to just get a feeling of the problems that you're experiencing and what might contributing, it's very interesting to fill out this. So see, most people are already identifying what is crucial to their tinnitus. I will leave a few seconds for the people that might also still need to think about it for a second. So is it a hearing loss? Is it feeling anxious or depressed? Is it a very big factor that you experience attention or sleeping difficulties? And what about the stress that you're experiencing? Okay, great. Everybody answered. So everybody is really in this webinar. It's not on the background, so that's very nice to see. And let me hopefully share the results also with you. So normally you should be able to see it, so you also get insight in other people's answers. But what we see here is that in 50% of the cases, hearing loss is a factor, but that's also already very interesting. In 50% of you, that is clearly not the biggest element. So that's already very interesting. It's not only hearing loss that is an important factor in the tinnitus story. And I think it's very recognizable that people feel anxious, feel stressed, and again, that interaction there. And we know that sleeping with tinnitus is not is challenging. And also I will come back to that in the end when we talk about tinnitus management options. So thank you for sharing that. And hopefully I will get you more clarity on all these different aspects. So let's start about hearing loss. How does hearing loss lead to tinnitus? You might already know, but I hope that the next video can help you understand it a little bit better. There is something wrong with my video. Let's quickly check what's going on here. I'm gonna quickly stop sharing and see if I can make this work again. Something is up here. Let's see. Okay. Seems like I'm gonna have to make a quick shift to other slides, but that should work. Sorry for the technical difficulty here. Let's see, try to share it again. Okay, normally you should be able to see. So what I wanted to show you is the following. You see that normally the brain gets input from our ear, but it starts detecting at some point that there is less input coming to the brain. So you see here the brain receiving less auditory input than normal. There is some signal going on. What it starts doing is compensating. It starts to be overactive. You see a really synchronized activity going on. Well, that's what's happening in the brain with tinnitus. There's a synchronized activity in your brain, and that creates a signal. Because it's a synchronized activity, our brain is going to detect it as a sound. So less auditory input leads to an overcompensation of the brain. That is one part. But that's not the only part. Like I said, anxiety and depression plays also a big role because we see that it's in the brain, it's not only the auditory area that is involved. So let me go further in this video where you will see that yes, there is an overactivity in the auditory area, but chronic tinnitus happens when there are three areas involved. The auditory area, but also our limbic system, which is our emotional hub, our emotional system, and the attention system. So it's only when that tinnitus sound gets an emotional connotation, a sort of people feel anxious about it, people worry about it, people don't like the sound, which is all very normal reactions to it, but that makes your limbic system firing very hard. And then the attention system, which is often involved also in the fact that people start monitoring their tinnitus. You suddenly hear something that you didn't hear before. The next morning, you're going to check, is it still there? You're going to try to understand it better. So we see that these three systems are really involved in keeping the tinnitus in your attention. So not only the auditory area, but also the emotional system and also our attention system play a role. And that's why anxiety and depression are so important. If you're anxious or depressed, your limbic system is going to react differently to your tinnitus than when you were not experiencing these symptoms. So that's an important thing to understand. And let me try to switch very smoothly again to my current slides so we can go further ahead. Because what I also want to talk about is the somatic system, to explain that a little bit better. Let me see. Yes, here we go. Normally, we're back at my slides where we were. So the somatic system, how does that influence your tinnitus? Well, what is important to know is that all input from our neck and our jaw comes into our brain and in the same area where the tinnitus is created. So there is a link between our somatic system and our auditory system. I always try to explain it as the following. When we eat, we don't want to hear ourselves eating. So that's why there is this connection in our brain that can influence our auditory area from the input that comes from the neck or the jaw. That also makes that neck or jaw can change our auditory perception and so our tinnitus. So in some people, the tinnitus is really triggered by discomfort in neck or jaw, or it even started after it, for example, after a whiplash. Then there is this clear link between your somatic system and your auditory system. So again, would be good to know here in the audience if people identify with that story. Let me share the next poll for you. So the first question is, do you experience discomfort at the level of your neck and your jaw? Because that's the first crucial question. Yes, I experience some discomfort at my neck. Yes, I experience discomfort at my jaw, or both, or I don't experience any discomfort there. So that's the first question you see. And that's the first essential one. If you have no discomfort, well, your somatic system will not be that much involved in your tinnitus. Normally, you will immediately also see a second question appearing. And that's mainly for the people that answered yes. Otherwise, you can answer not applicable to the second question. But if yes, if you feel any discomfort at your neck or your jaw, do you feel that they go together? So do your tinnitus increases or decreases together with the discomfort that you're experiencing? Or did the tinnitus start around the same time as the discomfort started in your neck and your jaw? So these are two essential questions already to know if that somatic system may play a role in your tinnitus or not. So let me see. I'm going to give everybody still some time to fill this out, to think of your neck and your jaw, start to analyzing it. Might be sometimes tensed. That is everybody after a hard day of working, there might be some tension there. But if it's a recurrent problem, it's very important to identify. Okay, nice. Everybody answered. So let me share the results with you. What we see is again a bit half-half. Half of the people don't experience any discomfort. And then you know your tinnitus is probably not that much somatically influenced, but 50% experience some discomfort at neck or jaw. Also, that is not abnormal. It's quite a high prevalence in the population that there are a lot of people with neck and jaw complaints. So the second question is more interesting to me. The people that answered yes, I experience discomfort. 1 out of 4 people here in the audience says that they experience a link between that discomfort. So that discomfort really goes hand in hand with their tinnitus. And that might be a sign of you having somatic tinnitus, and might be good to check this out with a physiotherapist. And 1 out of 4 really is really similar to the prevalence we know in the normal tinnitus population. So we also see 1 out of 4 tinnitus patients having an influence from the neck or the jaw. So important to acknowledge that and to identify that. Okay, great. Thank you for your input. But then how does that all work together? How does that lead to tinnitus? Well, I always try to explain it in one drawing. When I'm with my patients, I draw it. Here I try to do it a little bit more nice for you guys. So again, something is up with my slides. Not so lucky with the technical things today. That's okay. Luckily, I have my backup slides here and I can go on with those. Let's see. Yes. Okay. So how does that all go hand in hand? Well, like I said, in most people, it starts somewhere in the auditory area. You might not be aware of that at that moment, but at some moment, there will be some influence there. So normally what happens in a normal hearing system is from your cochlea, so from your inner ear, there goes stimuli to the brain, and in the brain, that is processed. Now, when there is hearing damage, so for example, noise exposure, it's the most typical thing, right? That damages the hair cells in your cochlea, but also age-related hearing loss, for example, influences your inner ear system. But it can be also other causes, sometimes more temporarily. If you had a very intense cold for a few weeks and there was fluid, for example, behind your eardrum, also that leads to a less well-functioning ear. And then our brain starts to detect, well, there is less input coming from the ear, so it starts to compensate and starts to create that tinnitus signal. Now, I saw earlier 50% of you said, no, the hearing loss is not an important factor with me. So why do I explain it like this then? Because that doesn't make sense for half of the audience here. Well, there are different explanations for that. First of all, it might be that your hearing is normal according to your ENT, but it might be normal for your age, for example. When you're 50 or 60 years old or older, and the doctor tells you, well, your hearing is still very good for your age, it's not a hearing anymore of a 20-year-old probably. So there might be already some hearing damage, although you don't identify that really as a problem, or it's really very subtle that you notice that in big groups of people, in big parties and stuff like that, that you start to realize that your hearing is not that perfect anymore. But even then, even it might be that you have the perfect hearing, still, according to the tests that the audiologist did, there is still something that exists that's called hidden hearing loss, which actually means, sadly, that we cannot measure all types of hearing losses. We know there is a lot of research going on that there might be a problem of the input from the ear going through the brain, so that there is a processing issue there on that pathway from the ear to the brain. So it might be that a normal hearing test doesn't capture all our hearing for the full potential, and that there might be some hearing losses that we're missing. So there is often, in the creation of the tinnitus signal, some type of hearing loss involved, but it might not be that you identify that as a crucial factor, because that might be there already for ages. And then at a certain point, your tinnitus starts. And that's because other factors are involved. So let me go first here. What can be involved, for example, is that you had already hearing loss for a while, but then in a period of stress, in a period of anxiety or depression, then suddenly your tinnitus comes to your attention. And that is because in that kind of periods, our filter system of our brain works less. When we're under a lot of stress or we feel less well, our brain is just gonna let all stimuli that come into our brain just come into our attention. It doesn't filter, is this important or is this not important? No, we just experience everything way more intense. And so we also can start experiencing that tinnitus. So that tinnitus might be already there somewhere in the background, but was always ignored. And then in a period of stress, your brain stops ignoring signals. It just gives all the signals to your conscious attention and says to you, deal with it. And well, then you have to start dealing with your tinnitus. And it might be also an and story. The impulses of the neck and the jaw increase your tinnitus signal, and suddenly you become aware of it. So these puzzle pieces really work together in the creation of your tinnitus. And it might be that the hearing loss is really a very small part of it, and it's actually more the neck or the jaw or the stress, the anxiety and depression that play a role. And what happens in the brain, and that was the previous slide here, it's a vicious cycle. So that the fact that the tinnitus signal is there is not the main problem. The problem is that it gets attention, that you get an emotional reaction to it. You know that probably you heard all your life that tinnitus is something you should avoid. We have to protect our ears because we don't want to get tinnitus, and suddenly you get tinnitus. It's a very anxious experience. So there is a huge emotional reaction. We might worry about the future and stuff like that. We start to monitor it, like I said. But that makes that our brain thinks, well, this is an important signal. We will bring it more into your attention. Yeah, your reaction will not be less. Your reaction will probably be stronger. And then it becomes again more in your attention. So you get caught in this vicious cycle where you don't want to give so much attention and emotional reaction to it. I'm 100% sure, but it feels like you're out of control because you're getting to this loop. Luckily, we can help you get out of that loop. So the tinnitus journey is then the one that should be determined. So how are these puzzle pieces gonna help you identify your tinnitus journey? Well, let me see if I can still go back to my other slides here. Let's quickly see, because ideally I want to show you some more visuals. Otherwise, I will try my best to explain it as well as possible. Let me quickly see. Sorry for the technical difficulties here. So let me already start explaining while hopefully I will get my slides back. There is these 4 stages in your tinnitus journey that we identify. 4 steps that you have to go through to start being able to manage your tinnitus better. And I think I'm lucky because I have no technical difficulties anymore. My slides are back, so I can share them with you, and that will make it way easier to explain all these tinnitus stages to you. So what are the tinnitus stages? The first step is awareness. At some point in your life, you became aware of your tinnitus, and you might experience that as annoying or distressing. That is always the first stage. You become aware of a sound that you didn't hear before. And then the second step that has to happen is a form of acceptance. And I know that's a very difficult word. It's not a word you might like, but we have to start accepting tinnitus as part of our life. Sadly, we know there is no cure for tinnitus that can make it fully disappear. And if we put that as a goal, we want tinnitus to fully disappear, that finish line is really far away, and it will be a very distressing journey because it gets very distressed that you don't reach that finish line. So why not put the finish line a bit closer? Why not ask, okay, let's already put the finish line at tinnitus will be there probably somewhere, but it's not a problem anymore. I would be very happy already if my tinnitus is there, but it's not distressing me anymore, and it's not impacting on my daily life. Then maybe there is no problem anymore. And I know if you're in these first phases, that might sound even impossible. But like I said, step 2 is just already accepting that tinnitus is part of your life. And that can be a difficult process. So you might develop feelings of anxiety about tinnitus. You might feel that the tinnitus is affecting your daily life. The third step is that you start acclimatizing. You start to adapt to the tinnitus. You become the tinnitus becomes less noticeable or less bothersome. And that can be achieved through various techniques that I will explain in a second. So therapies like sound therapy, CBT, mindfulness, relaxation can all help you in this phase. And of course, where we want to end is in the achievement phase, that you have managed your tinnitus, that the tinnitus is not longer a problem. That, like I said, you will still be aware of the tinnitus sound, but it's not longer causing you that distress or interference with your daily activities. So we understand that everybody experiences tinnitus differently, and each person's journey in finding tinnitus relief can be just as unique. Not everyone progresses at the same speed or has the same needs. So some people maybe find immediately tinnitus relief, and you might have that neighbor that had that quickly after a few weeks, but many require additional time and some additional commitments and additional therapy and guidance, and that's okay. It can typically take 3 to 6 months for someone to start perceiving the benefits of going through tinnitus management. So no matter where you are here in this journey, sorry, I see that my slides didn't go through. No matter where you are here in this journey, which step of the way you are, we are here to help you at Tinnibot to grow through that tinnitus journey. And so I'm very curious to also hear here in the audience where everybody is. Where do you feel that you are at the moment? Are you still in that first phase of awareness? Or do you feel that you already got some steps done and going through this journey? So I will start a new poll for you so I can get to know you again a little bit better. Where are you in this tinnitus journey at the moment? Meanwhile, while you're answering the poll, I want to remind you there is a Q&A section at the bottom of your screen normally. So if you have any questions and you don't want to forget them, at the end of the webinar, I will be gladly to answer all of the questions you may have. So put them in the Q&A and then I will answer them at the end of the webinar. So let's see. most people are still there despite the technical difficulties. So thank you for that. Almost everybody has identified where they are in their journey. Okay, great. It's good to see that most of you are already in the acceptance phase. And that's probably also why you are in this webinar, to find out more on how to go through that tinnitus journey, how to go to step 3 and 4. And that makes really sense. So yes, the tinnitus might be very impactful at this moment. Otherwise, you would probably not be here. But let me explain in a bit how we can get through these other phases. But also, if you're still in phase 1, that is also fine. If you're not there yet, that kind of acceptance is really a switch that has to come. And I think that only comes also through some start of tinnitus management. So if you're early in your tinnitus journey, you might need indeed still some steps there to come to that second phase of acceptance. And that might not be at this moment already reachable, and that is perfectly fine. So how can we at Tinnitus help you in that tinnitus journey? How can we bring you from that awareness phase to the achievement phase? Well, I will go quickly through them because I will go into depth in a bit. But what is important is, first example, psychoeducation, to better understand what is your tinnitus about, what are your tinnitus triggers, how does it come that your tinnitus might fluctuate. There is a chatbot function in the app that you might already have figured out that gives cognitive behavioral therapy, which is the golden standard treatment for tinnitus. And with CBT, we can identify what are the thoughts behind the tinnitus, why are we behaving in a certain way with the tinnitus, are we starting to avoid certain activities because of the tinnitus, and how does that influence our tinnitus today, and can we make some changes in our own thoughts and our own behaviors to find some tinnitus relief. There's also a way of creating your own habits in the app with your own daily exercises. So if you go into the app in the home page, like you see here on the screen, you can build a new habit. And so, for example, if you have identified that maybe it's time to start doing some deep breathing because you identify stress is a really big trigger in my tinnitus, maybe it's good for me to do some deep breathing on a daily basis, for example. You can put a habit and a kind of reminder to yourself to do this kind of things. So then in the app, you can choose like for how many minutes you want to do this breathing exercise for, and on which days, for example, you want to be reminded of this, at which hour, for example, you want to do it when just before you go to sleep, or actually at the start of the day, maybe to start the day already in a way that you feel less stressed. That might also be very useful. So you can really play with that and make your own habits in the app. You will also find a mindfulness space in the app, like I said, because of the relationship with stress and tinnitus. Also some sound therapy. Definitely in those first phases, people find it often very helpful that they can find some escape from their tinnitus in a way that for a period of time, they find it soothing to put extra sounds on in the environment to distract themselves from the tinnitus. Definitely, for example, when you have sleeping difficulties, but also know that there is the option to talk to a tinnitus expert in the app if you need some one-on-one guidance. So let me help you understand all these parts a little bit better. So psychoeducation and counseling, why is it so important to know more about tinnitus? Well, it is because the goal is to reclassify the tinnitus signal as a neutral signal. At this moment, the tinnitus signal is probably for your brain a very important signal, and that's why our brain brings it constantly into our attention. But ideally, we want our brain to identify the tinnitus as a neutral signal. as neutral as, for example, other sounds in our environment that are constantly there. The fridge makes a constant noise, our computer makes a constant noise. You might experience constant noise outside from cars, for example. And all those signals you're less aware of because they're neutral. You're not afraid of the fridge sound. You know that it's there. You don't care at all. While the tinnitus signal feels very different from that. And that is a change we want to make. We want our brain to identify it more as a neutral signal. Let me just quickly explain why that's so important. In our brain, what comes in our attention or not is determined by that limbic system that I was talking about earlier. Our limbic system will say to our brain, hey, this is an important signal, alarm, alarm, or very important, this has to go to the attention of this person. Or the limbic system will identify, this is a neutral stimuli, not interesting, you can ignore it. Like, for example, the sound of the fridge. So that's what happens, for example, when you're in a party, the cocktail party effect. When you're talking in a group of people, I think it's already very difficult to understand that conversation that's going on. The conversation behind you, you are not understanding at all. Unless someone says your name, and you will probably have heard that. So your name is already an important signal from the moment you're born, and our brain detects that. And so that means that that whole conversation in the back is processed by our brain, but it was constantly saying, the limbic system was saying, ignore, ignore, not important, focus on this conversation. And then it starts to notice your name, and then it says, but this is important, and it goes to your conscious attention. The same as someone who's afraid of dogs will already hear a dog from 2 kilometers further, just because from the moment there is already a small dog signal coming into the brain, your brain is going to immediately send it to your attention. While someone who's not afraid of dogs will not have that kind of alarm going off, and the brain will ignore it. So that's why it's so important that the brain starts seeing your tinnitus signal as neutral and not as a signal we have to be scared about, a signal that is important, and so on. How do we get there? First of all, understand our tinnitus better, of course. Understand the causes and triggers and understand its fluctuations. After a while, you will start to understand your tinnitus better, and then it makes you also feel less anxious. If you have suddenly an increase in your tinnitus, you might start to notice, okay, this is only a temporary phenomenon. I know this. I had a busy day at work. It was a stressful day. Then my tinnitus is now more intense. It's not so abnormal. It will go down again. So you start to feel a little bit more control on that part. That you understand that mechanism behind it, and that you get insight in how to habituate to the tinnitus, how to see that tinnitus more as a neutral signal, and how that can lead to a better management. So that are all parts of this psychoeducation that you can find also in the app. But then in a further step, you might already know a lot about your tinnitus, but still you're not able to get fully in control. Cognitive behavioral therapy might be beneficial for you to develop more coping skills and coping behaviors. So what is important in CBT is, first of all, to identify our behaviors. It's very normal that in a phase that tinnitus is very distressing, that you start doing everything that you can in your power to avoid more tinnitus. So you will stop, for example, going to dinner parties with friends. You might stop going to busy traffic because it's very noisy out there. You might avoid going to work, working more from home, because at work you're have more input and it's more stressful, for example. So you start to create a whole new life routine, all taking into account your tinnitus. And that is something that is often counterproductive. So what we see is that your brain starts to detect, like, okay, you're avoiding all the situations because of your tinnitus. That tinnitus must be very important. So the reaction of your brain is actually to bring that tinnitus more in your attention. So CBT helps you to shift the focus back, not the tinnitus that is the central element in your life, but you take control back. You decide what you're going to do, not your tinnitus. That's an important change that happens when you go through CBT. But also to identify your thoughts and your errors in your thoughts. We humans make mistakes in our thoughts, and that's how we are. We often think very black and white. That neighbor is always annoying me. My tinnitus makes me I can never relax with my tinnitus. You might think of a worst case scenario. Well, I had a patient that once said, well, if I would have a car crash and then my airbags would go off, and then I would maybe get hearing damage, and then my tinnitus might get stronger. A whole series of events that might even not happen. So you start already living in a scenario that is even not happening yet. So it's already giving you certain emotions that are not there yet. We might be living in that future, like I was just saying. So all these things, the app will help you identify and help think in a more, it's not thinking more positive, it's just thinking more rationally about the tinnitus. And also, like I said, there is the option here to have our inputs there and our guidance. And here is the QR code. If you want to book a 15-minute free video call to start with, that is definitely possible. So you can also find that back in the app. And then sound therapy. Why is that useful? Why can it be useful to use other sounds? You have already your tinnitus sound. Why would we add other sounds to our auditory system? Well, it might decrease your tinnitus signal by increasing the activity that goes on in the auditory system. So we start distracting the auditory system. We start distracting you. You get your focus away from your tinnitus, and that can be definitely helpful in very quiet situations. For example, when you want to concentrate or when you try to fall asleep. So in the app, you can really experiment with the sounds that you want to create. You can go even a step further with that and use a sound masker. A sound masker is an ear-worn device that has that constant noise on the background that you can fully often individualize yourself. You can choose the noise setting that you find nice, that you find comfortable, and that you find optimal for example, relaxation and reduction of your stress levels. It can be in combination with a hearing aid, for example. Definitely for those half of the people that know that hearing loss is something that triggers their tinnitus or that causes their tinnitus. Well, then a hearing aid might be useful. It starts to give you again more inputs, so it starts to stop that process that's going on in your brain, and it's not fixing the cause of your tinnitus because your hearing loss is not fixed with a hearing aid, but while you're wearing the hearing aid, it feels like you hear almost back to normal, and so your auditory system will also create less of a tinnitus signal. And so nowadays this can be combined. You have hearing aids that have a sound masker integrated. And then last but definitely not least, relaxation. For all those people who identify that stress is a big trigger, it is important to decrease that stress and the feelings of anxiety that you might experience through meditation exercises, breathing exercises. It doesn't have to be very difficult. It can be very simple, and the app is great at guiding you through that. So let me show you here in the self-care section. You can find relax and meditate. You can do a full body scan. I'm not 100% sure if you can hear this. But what you can see is while there is a body scan going on in the app, I can even choose the background sound that I find suiting for my tinnitus. And so at the start of the body scan, the person is going to guide you how you should position yourself to start this body scan. So like I said, you can find it. Let me quickly show you back in the self-care section under relax and meditate. So definitely a section that is interesting to find out more if you feel very tensed or stressed. And again, coming back to those 1 out of 4 here in the audience that feel a really influence of their somatic system, it might be needed to go to a physiotherapist to release that tension in your neck and your jaw. So to conclude this all, is it one therapy that fits all? No, we have to identify what are your puzzle pieces that contribute to your tinnitus. And then depending on those, you might identify which elements out of the tinnitus journey are important to you. Is it important to get involved into sound therapy and hearing aids because of the relationship you experience with your auditory system? Is stress an important factor, and do we have to go look into meditation? Anxiety and depression are feelings that are very prevalent in the tinnitus population, but CBT can really help you get more into control of those feelings by changing your thoughts. So let's do a last final poll to know how everybody's here. If I would now ask you at this moment, what do you experience helpful so far in your tinnitus journey? So it might be that you didn't have contact with all of these elements and you might not need even all these elements. That's what I try to say. It can be very important to identify what works for you, and that's not doing everything at once. It's probably identify what is important based on your triggers and your causes. You might find it helpful other parts of treatment. So did you find it helpful so far to get to know more about your tinnitus? Did you got already into some CBT and change the way you feel and you thought about your tinnitus and your behaviors? Maybe you find it very helpful to make time for relaxation or to go into the soundscape in the Tinnitus app to use some extra sounds to for some while escape from your own tinnitus sound or distract yourself from it. You might already have talked to a tinnitus expert and find it helpful. You might already experience that hearing aids can be useful in your trajectory. And last but not least, that's physio therapy for people with somatic tinnitus. They might feel that after they go to a physiotherapist, their neck and their jaw is better and their tinnitus is better. That's, of course, the goal. And that's very much a sign that you probably have somatic tinnitus. So let me share the results here. So it's very split, and that's normal. It's not that one of these solutions works for everybody. So it's very split. Most of the people find it helpful to get to know more about your tinnitus, and I think it's a crucial element for a lot of people because that influences how you will feel about it. But happy to see that all these elements can be helpful for some people here. And hopefully, if you didn't went through those steps yet, go through the app and find out what helps for you. And with that, I want to thank you very much for your attention. And I'm gonna have a look at the Q&A section here in the Zoom session to get answer to your questions. Meanwhile, if you're not familiar with Tinnitus yet, you can find the QR code here to scan it, and then you can get access to the app.